Hey everybody, Dr. Michael with Valiant Physical Therapy here in Evanston, Illinois, where I specialize in working with runners. I was evaluating a patient earlier this week for shin splints, and she asked me a very important question in the middle of the evaluation. She said, okay, how do you know that this is not something more serious? How do you know that I don't have a stress fracture or some type of a bone stress injury? That's a very good question because sometimes it can be difficult to differentiate between shin splints and a bone stress injury, because most often people with either of those two issues are going to experience them in the lower leg, kind of the inside of the tibia, kind of by the calf on the inside of the leg. So if you're dealing with a bone stress injury, you're most likely going to be able to point to a specific spot. And I know the people hearing this don't want to believe that they can point to the spot. But I'm telling you, if you can point to it, hey, it's in this spot, you most likely have a bone stress injury of some kind. Could be a stress reaction, a bone stress reaction, maybe not as serious as a stress fracture. Bone stress reactions and stress fractures exist on the continuum of bone stress injuries, but if you can point to it, like that specific spot, you most likely are dealing with a bone stress injury, okay? So her symptoms were more broad, and she was explaining to me that in a 5-mile run, she would feel the soreness in mile 1 or 2, and then it would go away by the time she got to a certain point, and then she wouldn't feel it for the remainder of the run, and for the most part, it was symptom-free after the run. When the symptoms warm up and go away as you're running more, you're dealing more with something similar to shin splints, not necessarily a bone stress injury. A bone stress injury is going to get worse as you continue to run. It's going to get worse with more activity. So if you're dealing with shin pain, okay, and it's more broad and it warms up as you run more, you're most likely just dealing with shin splints, and there's some training errors that you're likely making. But if you can point to the pain and it gets worse as you run more, you most likely have to come to grips with the fact that you have a bone stress injury. So I hope this helps. If you're looking for running physical therapy, my name is Dr. Michael. I'm in Evanston, Illinois. I can help you with your bone stress injuries, your shin splints, or any other running related injury that you might have that's inhibiting your training. Check out valiantphysicaltherapy.com to schedule a phone call with me. Thanks.